Hello, my name is Nafiza Anwar. I've been a nurse and midwife I'm a nurse midwife, so I've been in the service for over 25 years. I've been a midwife for 23 years now, and I'm currently working for Bedfordshire Hospital Trust and as the Better Birth lead midwife.
Could you briefly explain the work that the local maternity system and maternity voice partnerships are doing to help tackle the health inequality seen in mothers from an ethnic minority background, please?
So my role as the Better Birth lead midwife is about supporting the trust to roll out the sort of a national maternity transformation programme, of which Better Birth is an agenda, is an ambition, and it's about making sure that all women have safe, effective, personalised care, and especially focusing on women from Black and Asian and ethnic minority backgrounds, because we know from various reports that these women are the groups of women that have the higher adverse outcomes, and they are more at risk of dying in pregnancy and birth. We know the last Embrace report highlighted that Black women are 4 times more likely to die, and Asian women are 2 times more likely to die. So it's about working with the LMS and the Maternity Voices Partnership and co-designing and co-producing services to meet the needs of our women, and make sure that we don't bring about a service which is one fit for all. It's about making sure that we tailor services to meet the needs of the community, because this only will then reduce the disparities and the inequalities that do exist within our services.
Could you explain that where mothers could go for help and advice?
So mothers, obviously, there is, for most of our mothers, if they want information within the trust, there is our local website, and there is leaflets available and videos available. The leaflets are available in various languages. They can also access information from their community midwives. They will be readily happy to provide them with information and signpost them to anything that's available. We are working with the Maternity Service Partnership Voices in developing other sort of tools, other information packages that will meet the needs of our ladies. The MPV and LMS have developed a personalised care plan, which is part of the requirement that was set out in the Better Births ambition, and it's a document which is purely for the woman, so that she can sort of plot her journey, her pregnancy birth journey, and consult and get advice from her healthcare professional about the options that are available out there, when planning her birth. And it's about accessing information which is evidence-based from her healthcare providers, and it can be done through, some of these documents have been translated into various languages, so it meets the needs of those women. And also, we can use our interpreting services for the healthcare providers to inform the women if there's a problem with languages. So we are developing things to make it easier for our women within our community to have that information readily available out there. We're working on sort of digital platform as well to ensure that we have information available to the women and their families as well. Working with local community leaders, working with local, say, radio stations, working with hubs within the community, so that we can understand what is actually required by the women and their families.